Hello, my name is Dr. Diwan S. Raja. Today I will discuss about temporal arteritis. Temporal arteritis is the most common vasculitis in the elderly population. It is an important cause of headache. So we'll go through the temporal arteritis. So it is the inflammation of the superficial temporal artery. Okay. So it is a part of the involvement of the large and or medium size artery inflammation, a part of the chronic inflammation of the large or medium sized arteries. Okay, so what arteries may be involved? Certainly the superficial temporal artery. Superficial temporal artery is a branch of external carotid artery. It's two branches, one is maxillary. This is the superficial temporal artery. Superficial temporal artery. This is a branch of external carotid artery. This is external carotid artery. So what arteries are involved in a patient of temporal arteritis? Certainly superficial temporal artery, but it is a part of the systemic vasculitis, the most common vasculitis in the elderly population. We have vasculitis, temporal arteritis, also called giant cell arteritis. This is the most common arteritis in the elderly population, especially after the age of 50, and the average age is about 76. So artery involvement, external carotid artery and its branches, external carotid artery, internal carotid artery, internal carotid artery and its branches and its branches and its branches. Okay, there may be involvement of the vertebral artery, that is possible. Vertebral artery and its branches. Even there may be involvement of the subclavian artery, involvement of the aorta, and it may be related to aortic aneurysm. So multiple blood vessels are involved in giant cell arteritis, but most common presentation of pain is over the temple. This is the temple area. Pain here on the temple, okay, on the temporal artery. So we got that. The giant cell arteritis. Why it is called giant cell arteritis? Because we have this is a chronic granulomatous vasculitis. So it's because we have formation of granuloma. So in the granuloma, we'll get the giant cells, we'll get lymphocytes, we'll get neutrophil, we'll get fibroblast. Okay, so this is granuloma, this is chronic inflammatory mass. Giant cell is formed by the union of macrophages, Okay, so multiple macrophage, there is a part of the mononuclear phagocytic system. Multiple macrophages unite together to form the giant cell. Okay, so union of macrophage, you get giant cell. So if you take a biopsy of the temporal artery, we'll get granuloma, giant cells, we get lymphocyte, neutrophil, and fibroblast. Okay, so what is the problem? There will be some type of antibody formation in the vascular wall, and that will invite the chronic inflammatory cell, and there will be damage to the blood vessel, and there will be release of immune complexes, and those immune complexes that will go to the joint, so there will be associated only myalgia rheumatica. Okay, there is a possibility. So you got the giant cell arteritis. Now, what are the signs and symptoms? Signs and symptoms: headache, on the temple of the head, headache on the temple of the head. Okay, initially you can palpate this pulsation of the temporal artery. Eventually it will be pulseless because the artery will be obliterated. Okay, pulsation will be lost eventually. Okay, so there will be headache, there will be fever. Okay, there will be weight loss and anorexia. Okay, pain on multiple joints, in this person. Okay, there may be some ocular signs, symptoms like diplopia or double vision. Okay, there may be transient blindness. Okay, leading to complete blindness if it is not treated. Complete blindness. Okay, there will be jaw claudication, even tongue claudication, even the shoulder region claudication. Okay, we got that. So signs, symptoms, will get headache, fever, weight loss, anorexia, pain on multiple joints. There may be diplopia, transient blindness, also TIA, transient ischemic attack. Okay, that is also possible. transient ischemic attack, and jaw claudication, tongue claudication. These are part of the signs symptoms of giant cell arteritis. Okay, so we got that, and we have ocular manifestation because giant cell arteritis may involve the function of the extraocular muscles, especially the muscles innervated by the cranial nerve number 3, cranial nerve number 4, cranial nerve number 6. So there will be diplopia of vision, okay, because of the involvement of this cranial nerve, okay. And most important point is that the danger is complete blindness. Why there is chance of complete blindness? Very quick chance to get complete blindness. Idea is that the giant cell arteritis involve the ophthalmic division, the ophthalmic branch of the internal carotid artery, and ophthalmic branch of the internal carotid artery has another branch, the central artery of the retina. So if the ophthalmic artery is damaged, then central artery of the retina will be damaged. That will lead to complete blindness very rapidly, okay, due to involvement of ophthalmic artery, that is a branch of internal carotid artery, or central artery of the retina, that is an end artery of the retina. So there is chance of blindness, very quick development of blindness. So pain here, lack of pulsation later on, and painful condition here, temple, headache, and we got the sign symptom, weight loss, anorexia, fever, okay, and ocular manifestation, okay. It may or may not be associated with stroke, okay, may be associated with stroke, associated with transient ischemic attack or stroke, okay. That is possible because the vertebral artery, basilar artery, circle of Willis may be involved in this vasculitis. So who is the patient? Who is the patient? Elderly woman, after the age of 50, okay, and average age is around 76 years. Average age is around 76 years, okay. Scandinavian women, okay. Woman has more chance to get temporal arteritis than that of the African American women. Okay, we got the sign symptoms and the patient. Who is the patient? Now our risk is to protect the vision, to prevent blindness. So to go through that, we must diagnose it properly. Diagnosis gold standard is biopsy of the superficial temporal artery, okay, temporal artery, okay. It should be, we must take around 3 to 5 centimeters of the artery, okay. It may, the inflammation may be in patchy fashion, so we may do series of biopsy, may segment the artery, and we can do series of biopsy, okay. Then we must do the ESR. ESR means erythrocyte sedimentation rate. Erythrocyte sedimentation rate in the first hour. Sedimentation rate in the first hour. It usually should be, in case of patient of temporal arteritis, it should be above 50 millimeter per first hour, maybe 70-80 millimeter per first hour. Okay. Some liver function test. Okay. That may be conclusive or may not be conclusive. Okay. But this is the gold standard. Okay. So we got that. The test to diagnose it. Should we wait for the test result? No. If we get a patient around 70 years or above, there's pain on the temple, okay, headache, and she is a Scandinavian woman, most likely, and if this is the condition, then we should start steroid very quickly. Steroid, okay. Doses should be high dose. It should be continued for a long time. Okay. Idea is that steroid can protect vision. It may be irreversible at one time, but it should protect the vision if it is started very quickly and with adequate dose. Okay, that is the management of the temporal arteritis. So we got the temporal arteritis. We may summarize it. It is the most common vasculitis in the elderly population, especially in the women after the age of 50. Average age is about 76. Racial background, the women may be from the Scandinavian nations or from Scandinavian origin. Okay, there will be severe pain, headache, there will be fever, weight loss, anorexia. There may be every chance to lose the vision because not only the temporal artery is involved, also the internal carotid artery branch, ophthalmic artery may be involved, central artery of the retina may be involved. So there may be chance of blindness. So we should start with steroid, even getting this biopsy report. But this is the gold standard for the diagnosis of temporal arteritis. Yes, sir, we can get that. This is non-specific, but if it is very high, around 50 and above millimeter per first hour, there is also a diagnostic clue, but this is not very specific. Management by appropriate dose of steroid. So that's all about the temporal arteritis or gynecological arteritis. If you have any question, please feel free to ask me. Please support my channel and subscribe me. Have a nice day. Bye now.